I would like to thank all the board members for coming to this meeting and serving this year. We've had some pretty significant things come up legislatively, one in which is where they're trying to pass a National Fairness to Pet Owners Act law, which will impact all veterinarians in the state. What it'll ultimately mean as a veterinarian, if that law goes through, and the NVMA has written a letter in opposition, that veterinarians will have to write a prescription, physically write a prescription for any medication they wish to dispense. Once that prescription is written, the veterinarian then has the problem of they're not a pharmacist, they'd be unable to fill that prescription. So we're working hard to try to stop that from going through. The second one came up, and it has to do with controlled drug abuse in human beings. That impacts veterinarians, where now they're trying to pass a law requiring veterinarians to basically put everything into a drug database, which means a lot more work for the veterinarians, more exposure of your DEA license to your staff, especially if you're having them put in that prescription drug information. And then the potential that if you try to use their system to look up a person that you're worried that might be a drug abuser or user, if they're not a client, there's always a chance that that would be a ding upon your record. You could lose your license because of it. So we're working hard to try to oppose that added headache to our field that's already regulated quite well by the DEA.